British doctors have found that most coronavirus infections can spread by people who have recently become infected and have not yet begun to show symptoms. An analysis of outbreaks in Singapore and Tianjin in China showed that 2/3 and 3/4 of people, respectively, appeared to be infected by other people who were carriers of the virus but still had no symptoms. This discovery alarmed researchers of infectious diseases because it means that isolating people when they begin to feel bad is much less effective in slowing the pandemic than anticipated. Researchers in Belgium and the Netherlands used data on outbreaks in Singapore and Tianjin to determine the generation interval for COVID-19. The generation interval is the time between the infection of one person and the infection of another. This number is useful for estimating the speed at which the flash will unfold. The average generation interval was 5.2 days in the Singapore cluster and 3.95 days in the Chinese cluster. Scientists continued to calculate how many infections were likely to spread through people who incubated the virus but who did not yet have symptoms. There are uncertainties in the numbers because scientists did not have accurate information about who infected whom in the two clusters of the disease. But even the lowest scores show a significant transmission of coronavirus from people who have not yet shown signs of the disease. In the Singapore cluster, 45% to 84% of infections come from people incubating the virus. In China, the numbers ranged from 65% to 87%. Tapi Vaganyani, one of the authors of the study, said the figures show that isolation of sick people will not be enough to suppress the outbreak. It is unlikely that these measures alone will be enough to combat the COVID-19 epidemic. Additional measures, such as social distance, are needed, he said. The findings confirm recent comments by Maria van Kerkhove, head of the New Diseases Division of the World Health Organization, who said preliminary data showed that patients secrete more virus in the early stages of the disease, including in an asymptomatic state. But the authors emphasized that it is still important to isolate people with symptoms even if this is not enough to stop the outbreak. Doctors also admitted that the study examined outbreaks in which quarantine and other containment measures were already taken, which leads to an increase in the proportion of infections from people with an asymptomatic course. If control measures are less stringent, we think that this estimate will be lower. But the number of secondary cases will be higher on average, the study authors noted.